Good to know.
Lots to talk about. I could really go on for like an hour about this topic, so I will try not to make it like a monologue every time.
And that's why we've invited you here.
Okay. Diastasis is the pressure of the growing baby against your abdominal tissue.
Okay.
So diastasis is basically the midline. It can happen anywhere from your sternum all the way down to your pubic bone. And so right now, if you're not pregnant, normal is about, those two muscles sit like this close together. During pregnancy, they will separate. The challenge is we don't want them to separate too much. So if they separate too much, then they don't like to come back together, or they won't come back together a lot on their own. And so we want to minimize that outward pressure. So everyone has an abdominal wall that needs to stretch during pregnancy to make room for that baby. When we start getting into something that's symptomatic or painful, as you mentioned, it was a bit painful, or after you give birth, you start to feel like you've got loose skin that just won't quite come together, you have back pain, hip pain. Another sign of it is during your pregnancy. Did you ever see a little cone? Yeah, like every time.
Major like tenting?
You're tenting, exactly. Yeah. Coning, tenting. You would see that when you would get out of a chair or you would get out of bed in the morning, that kind of thing. That's a sign that your abdominal wall is separating. So if you're pregnant, you want to make sure that you're not seeing that cone too often. And as soon as you see that, roll onto your side, get out of whatever position you're in, because that's putting unnecessary pressure on your abdominal wall. So train the abdominal tissue to reconnect by using your breath and using your pelvic floor to sort of reconnect that tissue as best as you can. It's not going to go all the way back together because it was never together to begin with. It was here. So you can maybe bring it a little closer together. And we'll talk about, signs that it's really a problem and signs that it's more of a superficial kind of aesthetic thing as well.
Okay. Because there's other symptoms from it.
Yeah.
Like it does create other issues.
Yeah.
What are some of those issues?
Good question. So it is an aesthetic issue for a lot of women postpartum. It can also be connected to pelvic floor issues. So there are studies that show that women who have diastasis that's dysfunctional, so that no matter what they do, they can't quite get those muscles to come together, they have more incontinence issues. So they're more of the sneeze leaks, jumpy jacks are an issue, that kind of thing, like running, jumping, coughing. And I know we talked a little bit about that as well. Right. And so if you have the separation, then you're also more likely to have those incontinence issues. There's also a link towards all sorts of core dysfunction, which can cause prolapse, which is linked to basically your organs sort of start to descend downwards. And that's not something you might not necessarily feel because they grade it. So it could be a grade 1 or a grade 2. Usually you don't feel it until it's like a 3 or a 4. So it's just good to know where you're at with that. And it's really, really common. There's a lot you can do to sort of get everything back up through proper pelvic floor work.
Okay.
So we're always told not to pursue any exercise until about the 6-week mark with a newborn. With pelvic floor health, is that something that you need to wait for?
Good question. Great question. So no, you're good. Do nothing, except you are doing stuff. Like your babies weigh a lot, yeah? Car seats, all these things. Like you are, like as soon as you give birth, you have, especially if you have other kids, like you're doing heavy lifting. That's work.
Yeah.
And then they're like, okay, don't rehab anything. And then you do your check. Oh, babies.
I'll be back.
It's okay. I've developed a program that you can do literally if you wanted to, the same week that you give birth. And it starts with your breath. It starts with understanding the gentle, core breath. So you want to make sure that when you're breathing, you're not breathing up here. So you just start to really feel and connect to your whole 4-dimensional core.
Which is probably